The new diagnostic criteria of the Movement Disorder Society are actually in due time because so much has changed in our understanding of the disease. They are built on the old criteria we used to take for making the diagnosis, but what we tried to do was to codify the process an expert is applying when the expert is seeing a patient, because this is much more real, much more real in the clinical practice compared to only using criteria. So what we did is the following. We have two major steps. One is diagnosing Parkinsonism, and here we still have rigidity, tremor, one or both of the two, and bradykinesia is a must for Parkinson's disease, but we excluded postural instability because this occurs rather late in the disease course. And then there are the differential diagnoses we need to consider, and for that we have positives and negatives. Negatives as exclusion criteria or red flags, and positives which can be used as supportive criteria. But they are not only listed as criteria, we weigh them according to whether it's really important or not. We interpret them in the context when, for example, falls occur, and we also consider time, because time helps us to understand whether new symptoms occur or whether therapy is effective or not. And we can use additional assessments, for example, imaging or testing for hyposmia, as supportive instruments for supporting the diagnosis. So we have more of a complex approach to the disease, which helps us to better understand the complexity of Parkinson's disease and make the diagnosis in the context. Of course, we would love to diagnose the disease earlier, for earlier treatment, but we can't diagnose it so far before motor symptoms arise, which is unfortunately when more than half of the neurons in the substantia nigra have already degenerated. We know that.